Coming up on Newsnight, we explore a 10-year-old program based at Akron Children's Hospital. Now, if you're a child or a parent or grandparent of a child, you'll hope you'll never need it. If you do, it's a program that's gaining recognition around the world. The Hasslinger Family Pediatric Palliative Care Center. Next on Newsnight. Welcome to Newsnight for May 25th, 2012. Our regular panel returns next week for the final Newsnight before our summer hiatus. On this edition of Newsnight, we have the opportunity to explore an extraordinary program headed up by an amazing physician who is recognized nationally and internationally for the pioneering work she does. You know, there can be nothing more devastating or heart-wrenching than a child diagnosed with a chronic disease or a life-threatening illness. But there are compassionate and trained professionals who are able to walk that journey with you. That's what the Hasslinger Family Pediatric Palliative Care Center, Dr. Sarah Freibert, and the staff at that center are all about. They provide a palliative care program that stresses hope and life while facing medical challenges for children and their families. Dr. Sarah Freibert, Medical Director of the Hasslinger Family Pediatric Palliative Care Center, joins us to paint a picture of the palliative care available there. A little later on in the program, we'll be joined by Misty McMahon, who is a mother who has experienced the care and the concern of the Hasslinger firsthand. And any of the video clips that you happen to see during the course of the program are courtesy of Josh Gippen and his Joshua Tree Productions. Sarah, thank you for being with us.
Thank you for having me.
Why don't we start by you telling us a little bit about palliative care, and particularly palliative care as it relates to children?
Sure. Palliative care is a specialized medical discipline that really focuses on providing quality of life for children and families, and it's actually for any child or family facing serious illness. It's provided by a team of people, doctors, nurses, and other specialists who work together with the child's and family's primary care team doctors to really enhance quality of life and minimize suffering caused by pain, other symptoms, and even stress when you're facing a serious illness. It works best when it's provided together with curative treatment from the time of diagnosis.
In the case of children, palliative care, which is often a buzzword for hospice, is not necessarily end-of-life issues, correct?
Far from it, Jody. We do certainly work with children who are going to unfortunately face their end of life. It's a fact that that happens. But really more what we do is work with children from the time of diagnosis throughout their illness journey. And many of our children do just fine. We actually have graduates from our palliative care program. So again, it's about walking that journey of a serious illness, whether it ends in death or cure.
The Hasslinger Family Center, the palliative care that you offer, is available here at Akron Children's Hospital. But what is give us some of the demographics, the child numbers that you deal with, and the geographic area.
Our program actually covers a very wide geography. Akron Children's has a primary service area of about 26 counties, but children in our palliative care program come from 44 of Ohio's 88 counties, as well as some surrounding states. So it's very spread out. Children and their families live out in the community, and they want to stay there. So our job is to go where they go.
And what kind of numbers are we talking about in terms of your population?
Our program has cared for over 1,700 families in the 10 years that we've been around, which actually makes us one of the largest programs in the country.
You have described what you do as a palette of care, so explain a little bit more about that for us.
Most people know that a palette is an artist's representation or a container that an artist uses to put paint on before painting a picture. And what we envision with the palette is that all of the different people who work on our palliative care team represent colors on that palette. Their disciplines are on that palette. And what we try to do is give the family that palette and a paintbrush and ask them to literally dip their brush into each of those colors and choose which disciplines or specialties or people they need to help them paint that picture of quality of life for their child.
So much of what you do is the team concept, with the various skills that those different team members bring to the care of the patient and the family. Explain a little bit about that.
Absolutely. We work best as a whole, what we call an interdisciplinary team, recognizing that we all have our own areas of specialty, but that when we work together as a team, we're greater than the sum of our parts. So we have people with all sorts of different specialized training, from medicine and nursing to child life to dietitians, massage therapists, expressive therapists, meaning art and music, all kinds of different people who bring their skills and talents and really their spirits to bear as we work together to enhance that journey for children.
And it is a family-centered care, correct?
Absolutely. Children exist in families. They have brothers and sisters, they have parents, they have grandparents, they have pets, they have school buddies, they have groups that they belong to. And all of those people and all of those pets and the whole system really suffers when a child is suffering. So our belief is that by working as a team to enhance everyone around that child, it gives that child an even better quality of life.
What you do is not just limited to within the walls of the hospital, is it?
No, absolutely. We make a lot of home visits. That's actually one of my favorite parts of my job. It's really true that doctors do go out into the home. We also work with children in school and children in their community agencies or wherever they are. We go to long-term care facilities. It's rare that children live there. We will sometimes go to children's events and meet with the other people who work with them and care for them. So many of our team members are often in the car, driving out to those 44 counties and really just going to where the children are to provide that kind of care. It takes the pressure off the family to have to come to where we are, pack up everything that encompasses the child's medical equipment, the other siblings, and come to us. And it also gives us a chance to see the child in his or her own environment. Children are happiest when they're not in the hospital, and we actually get a much better picture of what life is like for them and how we can be helpful to them.
Speak with us for a moment about the very difficult job of caring for seriously ill children facing end-of-life issues.
A lot of people ask me that. It's a sort of that cocktail party question of how can you do that? How can you do what you do? And I'm really being very genuine when I say that I get far more out of this work than I put into it. These children are amazing spirits who have faced their journeys with the kind of courage that you and I will never have. And they inspire me every minute of every day. And their parents and their families do as well. It's just the kind of job that it's not a job. I wake up in the morning and I'm grateful to be able to walk with these families, and I'm honored that they allow us into our lives. They share with us in ways that are just incredibly intimate and amazing.
The Hasslinger Center is recognized nationally and internationally. This is almost a new kind of specialty. What kind of responsibilities does that place on your shoulders?
Palliative care is really an emerging field. It's been around for 20, 30 years as an outgrowth of hospice, as you mentioned, but pediatric palliative care is really kind of a new child on the block, if you will. And over the last 10 years, it's really grown quite a bit. And there are, however, despite the growth, there are not that many well-established programs. So we have a lot of folks who are looking at us to see how we're doing, what we're doing it, how are we measuring it, how are we delivering this care, how can we pay for this care. We actually have folks who come and spend time with us to learn how we do what we do. And I frequently get invited to go and speak and share our knowledge throughout the country and also in other countries to help spread this. I think the sense of responsibility comes from really wanting to create the kind of program that is a great example of all of that, but also to make sure that every child who needs this kind of care has access to it, no matter where he or she lives.
Well, I know that the Hasslinger Family Center is now celebrating its 10th anniversary.
Yes.
And one of the things that has been prepared for that anniversary is a documentary by Josh Gippen that is going to be available later on this summer. We want our viewers to see what, in fact, some of the things that Josh has put together, because some of the best people to explain what palliative care is and the Hasslinger Family Center is for children are the people who have experienced it themselves.
They're like a warm blanket around your baby. No matter what your baby's going through, they are there surrounding that child, and every child is treated like an individual.
And that's what I think makes their team successful, is it is so patient specific. They're caring for our child and for us and helping us live life every day the best that we can.
Just when you think that they've done everything that they could do and that they have serviced you in every way, they go above and beyond to do something that you just can't believe.
And he was basically like my angels in human form. That's what I tell them all the time. And Dr. Freeberg and her team, they were able to skillfully, masterfully work around our attitudes and our preconceived notions to become the best friends, best advocates that we could have ever asked for.
One of the people who has used the Hasslinger Center as a best advocate is Misty McMahon and her family. Misty joins us now. Misty is the mother of 4. Buddy, her son, died in 2005. She has 2 daughters, and her son Cameron, who is 5, also suffers from the same illness that Buddy had, Menkes syndrome. So, Misty, first of all, our condolences for what you have gone through, and thank you so much for joining us.
Thank you for having me.
Tell us how, in fact, the Hasslinger Center came into your lives.
In 2001, Buddy was born, Nathaniel, and he had had a stroke, but at the time we thought it was a urinary tract infection, and then from there he had really bad seizures, and he was taken to a hospital where he had stayed for 2 months where they did extensive testing and they couldn't figure out what was wrong with him. And then a med student actually had diagnosed him, and once we found out about the Menkes syndrome, then they basically sent us home and said that they didn't know what they could do for us, basically that he was just going to go home and die. And through prayer and looking at information online and everything, finally the palliative care had called us, and they had gotten a referral, and Sarah and the rest of the team came out to our house, and that's kind of how we met. And from there we just talked about different services we may or may not have needed at the time, and our journey began right there.
How did Sarah and her team and the whole palliative care program, how did it make a difference in your life, in Buddy's life, and now in Cameron's life?
Oh, they've been a huge gift from God to us. I mean, at the time we were starting out, young parents, second child, we didn't know what to expect, especially with the diagnosis, because only like 0.001% population-wise get it, and with it being so extremely rare, all of us really didn't know what we were getting into. But with Dr. Freebert and the rest of her team, they helped us out so much. There were times I was just so stressed out, and I felt like I just couldn't take anymore, and I'd call up the team, and they'd say, oh, well, why don't we call the insurance company for you, or, call this doctor, this specialist for you, and they were there to, hold our hand and help us through the whole, journey and everything. And in the beginning, Buddy was in a lot of pain, so they helped us with some pain management issues, and it really helped him out a lot.
Tell us about the fact that in a lot of cases I've heard the team described as an extended family. Okay, was that the case in your case, where the team became part of your family, part of your lives?
Most definitely. Even now, still this day, they're still our family. We don't go and see them as much because Cameron's doing well, but I mean, even after Nathaniel died, I did some grief counseling through their center, and that helped me out a lot. And through the holidays, they have holiday programs where we go, and in memory, we honor our children, and that means something to not just me, but my family and Grandma and Grandpa and aunts and uncles. We go every year, and they're always there with open arms. I mean, they truly are like our miracle and our gift from God, that they're, a part of our lives, and still this day, they are. And it's really helpful because every year they remember Nathaniel's birthday, his anniversary from when he died, and we always look forward to getting the cards in the mail, just with little memories that they might remember that maybe we forgot, and it's just a really good way to honor him.
Sarah, is Misty typical of the families that you have a tendency to deal with and care for?
Not typical in the sense that we don't often have 2 children in the same family who are affected by a syndrome, although that does happen, but very typical in the sense that we get to know them, the family, very early on, try to meet them as close to diagnosis as possible, and really stay with them throughout, no matter what happens. And unfortunately, in Buddy's case, he did die, but he had a wonderful life for the time that he was alive. We tried to work with the family to keep him out of the hospital as much as possible. And then once we always joke that we become glue. Once we get involved with them, we never leave unless they want us to. And so keeping them as part of our family is very typical of how we work.
Misty, if you could let our viewers know what you think is important that they know about Dr. Sarah, about the Hasslinger Center, what would you say to our viewers?
I would say that a lot of people think when they hear palliative care, they always think the worst. But really, I think people need to just embrace that, you know, people like Sarah and her team are actually a gift from God, and they're there to help you and help loaden your burden. And I couldn't, now that I think about it, now that Nathaniel's gone, I am so glad everything played out the way it did, because that last day that he passed away, it wasn't sad. We had just a normal, happy day. Everybody got to come see him, and he died so peacefully. And it was thanks to the Akron Children's Palliative Care. They were there with us. They didn't pressure us into anything that we didn't want to do. You know, I could have or couldn't have changed my mind. You know, they were there as like added support and like family. And it wasn't just our loss, it was their loss, you know, too, because they're a part of our family. So I just want people to know that, you know, if you do get this special opportunity or gift like we do, and you're going through what we're going through, you know, you need to embrace it.
Misty, thank you so much.
Thank you.
Sarah, talk a little bit more about palliative care, especially for very ill children. And you did touch on it at the beginning of the program, but how do you do what you do? What kind of emotional toll does it take on you or on the team?
Well, as Misty said, we do become part of the family, and every time we lose a child, that is a loss for us. But it's not quite the same as the parent who's losing the child. And I think because we're able to offer so many supports and really be of help, that helps sustain us as well. One of the biggest things that we focus on is really goal-directed decision-making, trying to help families who are overwhelmed by the medical system that's often very fragmented, navigate their way through that system and really make good decisions so that, like Misty and Rob, they can look back later and say, we did the very, very best we could. We couldn't change what happened to Buddy, but we can change how we felt as parents, how we felt efficacious as parents. And now in raising Cameron, who thankfully was diagnosed very early, has started on treatment and is doing very well, they can use some of those same decisions and the learning that we all had together to help be really great parents to him too. And that's what keeps me going. It may sound corny, Jody, but it's really true, that when we work with these families and we get to be part of their lives, we grow and we change, and nothing is more powerful or honorable than that, honestly.
Pediatric palliative care is kind of a new specialty field, is it not?
It is.
It's only in the past couple of years that it's really come to the forefront?
Our center's been around for 10 years. There are centers that have been around a little longer than that. But now, just in the last 2, 3, 4 years, the number of programs is really growing. It's catching on, as you're alluding to. I think people are figuring out that this kind of care is what families want. It's what they really need to survive, and it's not the scary thing that everyone thinks that it is. It's actually quite logical that we would work with families whose children are very ill, who have complex medical problems, and try to help them in that fragmented healthcare system go through that. Unfortunately, the number of children with complex chronic illnesses is increasing, even though the survival rates are getting better and children are not dying at a high rate. We are seeing more and more children who have medical equipment, who have multiple medical needs, and families like Misty's go home from the hospital without the necessary resources or supports to really provide the best life for their children. So,
because they want their kids in their home, correct?
Absolutely. Yeah. Children do best when they're at home in their own communities with their brothers and sisters, and they don't want to be in the hospital. They want to be where they want to be. They want to be playing if they can.
Sarah, why has it taken so long for palliative care for children to come into the mainstream?
Well, I think it's multifactorial. Some of the things that Misty mentioned, people are afraid of the words. They don't want to think about it. We have a culture here in the United States that's very death-averse. We don't want to focus on anything but cures and miracles. So it's hard for us to talk about things that might be difficult. It's also because we really have focused as a society on the greatest new technology and pushing the envelope back to doing more and more wonderful things, which are very important to extend the lives of children. This type of care is not a money-making enterprise. It takes a lot of people to do this work. It's financially challenging, and so it's taken a while to come up with creative models to be able to deliver this kind of care in the way that it needs to be done. But when you look at hospitals and acute care, it hasn't been on the radar screen really of something that has been of value until recently.
You talked about challenges, and that's the next question I want to ask you about. Your palliative care at Hasslinger Family Center is now 10 years old. What are the challenges that you face going forward?
Really, the biggest challenge is twofold. One is getting the families out there, the public, to be aware of the services that we have and not to be afraid of palliative care. The other is financial. We really do provide a whole host of services, most of which are not reimbursed in our current healthcare system. So physicians like me are paid for some of our services at a very small rate. Nurse practitioners are paid, and some of the therapists we work with can bill. But all of the support people that Misty was talking about, case management, bereavement specialists, expressive therapists to help children who don't speak verbally, those folks are not reimbursed in our current healthcare system. And it's very expensive to deliver this kind of quality care. We believe that that cost is far lower and there's cost savings to be realized later on down the line, but it requires an outlay at the beginning to create these kinds of programs.
Do you need partnerships within the community? And if you do, what kind of partnerships do you need or do you use right now?
Absolutely, we need partnerships. We actually started the program in partnership with many of the agencies and community-based practitioners who are here in the Akron community. And we work with them now and will continue to grow those relationships because as we're trying to get farther out into the community and let children stay where they are, we need to bridge those gaps by working with the child's primary care providers, with their specialists in the community, with all the agencies who take care of them, with their schools. We work with a lot of home care agencies who are in the homes providing nursing care, sometimes directly to the children, as well as hospice agencies when that's appropriate. So really, we spend a lot of time navigating those collective journeys. We will often do visits together, for example, and a lot of telephone support as well.
I want to talk about the role of volunteers, because obviously you rely a lot on volunteers. In fact, in the interest of disclosure, I am a volunteer member of the Hasslinger leadership team, which is how I first came to know about it. So how do volunteers figure into your palliative care?
Volunteers are our mainstay, and thank you, Jody, for being a volunteer. We have volunteers who work in a variety of different ways in our center. Some of them actually provide direct patient care, are in patients' homes. Some of them work with families who are in the hospital and just sit with kids, hold them, read to them, do activities with them. Some of them are involved in our office doing some of the tasks that we need. We mobilize volunteers around the holidays and for special events. We use a lot of volunteers in some of the groups that we run that Misty was mentioning. Our leadership team is a group of very dedicated volunteers who are helping us get awareness into the community and also helping us raise money so that we can continue to deliver these services directly to families. We couldn't live without our volunteers.
You have a special gala coming up in July, which will celebrate the 10th anniversary. Tell us what's planned for that gala.
We're having a birthday party. The Hasslinger Center is turning 10, and we're going to have a party at the Akron Civic Theater on Friday, July 27th. Anyone is welcome to attend. And what we really want to do is celebrate the fact that Akron Children's was progressive enough to really see the benefit of creating a center like this, that we want to celebrate with our families and our friends who have helped bring the center to fruition and who have benefited from its services. We want to thank our volunteers. We want to see a premiere from Josh's documentary that he's been working so hard on. And we just want to have a good time. So we would welcome anyone to come.
Well, and I heard tell of a karaoke type moment here that could possibly take part on stage.
Well, we are having a singing and or lip syncing contest so that people can enter that and raise money for the center. All the money that we raise will go directly to the support of patients and families. And you can bring your favorite song, and you would be welcome to be one of the musical acts. And I hear tell that the center's director might be doing that as well.
As you go forward into the second decade, what is it that you need and what is it that you hope for?
What we need and what we hope for is that the way that healthcare reform comes to fruition in this country really begins to recognize that this kind of care is logical, it makes sense, it's what families want, and it actually helps providers take better care of the patients and families that we work with. So to that end, we need to design systems that favor cognitive therapies, meaning we're sitting and talking with families, we're helping them understand the healthcare system and make good decisions, and that we move away from procedure-driven medical care that favors that kind of aggressive, high-tech treatment all the time. It's certainly appropriate when it's appropriate, but we also need to be fairly paid for the services that really provide this umbrella of support. So my hope is that legislation and financial models will change in a way that makes this a sustainable enterprise and something that all hospitals and all healthcare systems will embrace, so that, again, every family who needs it can have access to it.
Sarah, if people want to get in touch with the Haslinger Center, how do they do that? Are you on the web, phone number, whatever?
We are on the web, and we're also available actually 24/7. The web address is akronchildrens.org/palliative care. If you just get to Akron Children's, though, you can find us by putting in Haslinger or palliative care. We'll pop right up. We have our own website within the hospital website. And our phone number, 543-3343, area code 330. And somebody is always available. We're available to our patients and families 24/7 if people want more information or would like to volunteer or would like to help us out.
Sarah, thank you so much for the work you do, the amazing woman that you are, and
Judy.
help. And Misty, thank you so much. Best of luck to you and to Rob and to your entire family.
Thank you.
And thank you for joining us here on NewsNight. Good night.